Finance Minister Nirmala Sitharaman on Monday announced a new centrally sponsored scheme for the health sector in her 2021-22 budget speech in the Lok Sabha. The Finance Minister, who began her budget speech by acknowledging the frontline workers amidst the global coronavirus pandemic, said that Rs 64,180 crore will be invested over a period of 6 years to improve primary, secondary and tertiary health care. This is in addition to the National Health Mission, announced the minister. Over 15,000 schools will be qualitatively strengthened under national education policy. While presenting her third Union Budget 2021, Nirmala Sitharaman added that 100 new Sainik schools will be made and other umbrella structures to be created for higher education. The budget proposals for 2021-22 rest on 6 pillars: health and well-being, physical and financial capital and infrastructure, inclusive development for aspirational India, reinvigorating human capital, innovation and R&D, minimum government and maximum governance, Sitharaman said before presenting the first set of Union Budget 2021. The total budget outlay for healthcare is Rs 2.24 lakh crore, which is an increase of 137% from last year. Health outlay to be used to establish critical care units and hospital blocks. Investment in health infra in Budget 2021 has increased substantially, said the Finance Minister. 3 areas: preventive health, curative health and well-being will be strengthened during the current year, she added. A new centrally sponsored scheme, PM Atmanirbhar Swasth Bharat Yojana, will be launched with an outlay of about 64,180 crores over 6 years, she said. She announced that 17,000 rural and 11,000 urban health and wellness centers will be set up and integrated public health labs will be set up in each district. Amid the ongoing COVID-19 pandemic, Sitharaman announced that the Narendra Modi-led government will provide Rs 35,400 crore for COVID-19 vaccination in 2021-22. The pneumococcal vaccine, a made-in-India product, is presently limited to just 5 states. It will be rolled out across the country, they noted, adding it will avert over 50,000 deaths annually in the country. The pneumococcal vaccine is effective against potentially fatal pneumococcal infections like pneumonia, septicemia and meningitis. Talking about India's fight against COVID-19, Sitharaman said the country has 2 vaccines available and has begun safeguarding not only its citizens but also those from hundreds of other countries, adding that 2 more jabs are expected soon. Finance Minister added that the country will provide 2 more COVID vaccines. Last year, the government allocated Rs 99,300 crore for the education sector. It introduced a new education policy which aimed at universalization of education from preschool to secondary level. In this policy, the government announced that students will not be forced to study any particular language. Also, the 10+2 structure will be replaced with 5+3+3+4 model. It proposes a 4-year multidisciplinary bachelor's degree in an undergraduate program with multiple exit options. These will include professional and vocational areas. Not just this, in NEP 2020, government changed the policy for the upcoming teachers and teacher education. To become a teacher, one requires a minimum of 4-year Bachelor of Education by 2030. Also, the teacher recruitment process will be made transparent. It may be noted that for the first time, the budget was presented in a paperless format. Sources said the Union Cabinet headed by Prime Minister Narendra Modi approved the budget 2021-22. News Desk Kaumudy, English.